Hello, dear nursing aspirants. Welcome you all to the Master Nursing classes. Myself, Mr. Nagraj, AIMS Nursing Officer, and your NORCET guide and RRB guide. So, here I am in front of you all today to discuss the RRB old question papers. As all of you know that we have discussed the part 1 session of the RRB old question papers. So, in that one, I have discussed the very important questions that they came in the previous year 2018. Okay, and what are the possible questions that may arise in your upcoming exams. So both I have discussed in that part. Okay, so in this today's session also we will do the same. We will see the very important questions that they have asked in the previous year. Okay, so then after that we will deal each and every question in detail. Okay, so that if they can ask the extra questions on that particular concept also, we can easily solve the question and get the good ranks in the exams. Students, it's very important in the RRB nursing superintendent exams. Okay, so almost all of you will get fast. Okay, all of you will score the that is eligibility marks, but the post which are came, that is reason wise. Okay, so there are very less post number is there, like in some area only 40 posts are there, in some area 100 posts are there, in some area 80 posts are there. So if you want to get the seat there, you have to get the rank that is below 100 in that particular region with your caste and every support. Okay, so that is very much important to get the good rank. So in the last year RRB 2019 paper, I am saying, so in that paper they have asked the 8 to 9 questions similar from the 2018 paper. Okay, and 5 4 topics like they have asked from same concept questions. So that is what it is very important to discuss the RRB old question paper in detail. Okay, so if they can ask the any questions from the old question papers or any questions from that same topic, we can solve it easily. So that's what I am discussing each and every question easily, simply, and very understanding manner and very effective manner. Hope the session will very much helpful for you all. So my request is to have the notebook and pen, sit in front of the video lecture, watch the video lecture completely. Okay, while watching the pause the lecture. Okay, make your own notes and revise during the exams. So this is the request from my side. And if you are not aware of the part 1 video, it is there in the playlist. You can watch that one also. And if you are new to my channel, so don't forget to subscribe to the channel. Okay, so without wasting the time, we will start the today's class. It's very simple. First question. Okay, read the question carefully, then give the best answer for this question. Okay, so what question says here? Yes, the question is very simple. What is the normal human blood? Okay, what is the normal pH of the human blood? What is the normal pH of the human blood? Okay, so the simple question. Yes, option A says it's a 6.5 to 7. Option B says it is a yes 7.35 to 45. C says it is 8 to 9, and D says it is 4.5 to 5. Okay, so what is the correct answer for this question? Yes, all of you are giving the correct answer. That is the normal pH of the human blood is between the 7.35 to 45. Okay, so this is the answer for this question. Okay, so the next question is from this question only. I am asking what is the normal yes partial pressure of the oxygen. What is the normal PaO2 of the oxygen here? Okay, can anyone able to answer for this question? It's very good, students. Who are telling that is 80 to 100 mm of Hg. Okay, 80 to 100 mm of Hg. This is the normal partial pressure of the our oxygen. So I am asking what is the normal partial pressure of the carbon dioxide in the blood? Okay, what is the normal partial pressure of the carbon dioxide in the blood? Okay, that is the yes, very simple, 35 to 45. Okay, same again mm of Hg. Why? Because I am asking the partial pressure, students. Okay, if the question comes what is the normal saturation of oxygen, that is SpO2. So you can say the answer in percentage. Okay, that is more than 95 percentage, or you can say the range answer as the 96 to 100 percentage. Both answer are the same here. Okay, so hope the concept is clear till yet. So these are the possible questions they can ask in the exams also. Okay, so the normal bicarbonate level, what is the normal bicarbonate level in the blood? Yes, that is the 21 to 27 mm of, sorry, it's millimeter of mercury, sorry, it is a milli equivalent per liter. It is milli equivalent per liter. Okay, so very simple question. So we can hold the answer like this. Yes, hope the concept is and question is clear for you all. I'm moving to the next question. Okay, so here's the next question. Do read the question carefully, then give the answer for this question. Yes, the question says here, yes, extrapyramidal symptoms are side effect of. The question is asking, ಕ್ವಶನ್ ಅಲ್ಲಿ ಏನ್ ಕೇಳ್ತಿದ್ದಾರೆ ಅಂತಂದ್ರೆ ಎಕ್ಸ್ಟ್ರಾ ಪಿರಮಿಡಲ್ ಸಿಂಪ್ಟಮ್ಸ್ ಯಾವ ಮೆಡಿಸಿನ್ ನ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಗಿರುತ್ತದೆ. ಸೊ ವಿಚ್ ಡ್ರಗ್ಸ್ ವಿಚ್ ಕಾಸಸ್ ದ ಎಕ್ಸ್ಟ್ರಾ ಪಿರಮಿಡಲ್ ಸಿಂಪ್ಟಮ್ಸ್. ಸೊ ದ ಕ್ವಶನ್ ಇಸ್ ಇಟ್ಸ್ ಸಿಂಪಲ್, ದಟ್ ಇಸ್ ದ ವಿಚ್ ಡ್ರಗ್ ವಿಚ್ ಕಾಸಸ್ ದ extra pyramidal symptoms. Option A here as the antipsychotics, option B here as the anti-manics, and option C here as the antidepressants, and option D here as the anti-Parkinsonism agents. So which drugs which causes the extra pyramidal symptoms? Students, you have to know the basic concept in the brain. Okay, in the brain there are areas. Okay, premotor area, motor area, and all. So just behind the premotor area there is in the extra pyramidal tract. In the just behind the premotor area there is the extra pyramidal tract. Whenever we will take the antipsychotic medications, it will damages the our extra pyramidal tract, that is very much responsible for the motor coordination of the body. Okay, so whenever there is a damage to the extra pyramidal tract in the brain, so that disturbs our motor activity, so which produces the extra pyramidal symptoms. Okay, that is a classical seen in the antipsychotic medications. In the antipsychotics we are having the two kinds of the antipsychotic students. So that is the typical antipsychotics. Okay, typical antipsychotic and atypical antipsychotic. Okay, typical and atypical antipsychotics. Among these two, typical antipsychotics only causes the extrapyramidal symptoms. In atypical antipsychotics there is less chance of the causing the extrapyramidal symptoms. Okay, from the typical antipsychotic medicine, which drug which causes the maximum antipsychotic effect is the, that is the haloperidol. Okay, haloperidol is the antipsychotic medicine which causes the maximum extrapyramidal symptoms. Okay, so it's very important to know and remember. Okay, which antipsychotics causes the extrapyramidal symptoms? That is the typical antipsychotics causes the extrapyramidal symptoms. Which is the which antipsychotic which causes the maximum extrapyramidal symptoms? That is the haloperidol is the drug which causes the maximum extrapyramidal symptoms. Okay, so hope the concept is clear here, and the answer for this question would be yes, all of you have given answer, that is the antipsychotics. This is the correct answer. Okay, so what about antimanics? Antimanics are the drugs which are given in the patient with the mania. Okay, so we can say the mania also, where there is in the severe elevation in the mood will be there. So that is what we call the mania. So the drug of choice for the mania, okay, that is the antimanic drugs, that is the lithium carbonate. Okay, that is the lithium is the drug of choice. Students, in lots of exams, nursing competitive exams, they have compulsory ask the questions on the lithium. We will discuss the lithium separately, okay, while discussing the psychiatric important topics for your RRB exams. Okay, so then option C comes here as the antidepressants. These are the medicines which are given in the treatment of the depression. Okay, in the antidepressants there are the various classification of the drugs like tricyclic antidepressants. Okay, and serotonin like SSRI, selective serotonin reuptake inhibitors, and there are many more classification are there. So very important medicines we will again discuss while discussing the antidepressants medications. Okay, in anti-Parkinsonism medicines, okay, there is the very widely used the two drugs they can ask in the exams. That is the levodopa, okay, and carbidopa. Which all are the drugs? Okay, that is the levodopa and carbidopa. So you can see here in the both drugs the dopa is the common. Okay, dopa is the common. So means these drugs are given to increase the dopamine in the our brain. Why? Because in the Parkinsonism there is deficiency of the dopamine. Okay, dopamine deficiency will be there. So in order to compensate that dopamine deficiency, we will give the external dopamine, that is the levodopa. Okay, so the carbidopa drug will be given in support of the levodopa. This will helps to cross the blood brain barrier for the levodopa. Okay, that's what the carbidopa will be given along with the levodopa. Okay, so both this medication, it will comes in market with the name of the syndopa. Okay, syndopa. Okay, syndopa considering both levodopa plus carbidopa. Okay, so these medicines will be given in the Parkinsonism, students. Hope the concept is clear for this question, and answer for this question would be yes, antipsychotics. Yes, here is the next question in front of you all. Very basic question. All of you can give the answer very much easily. Okay, so here is the question. Yes, the salivary gland secretes the saliva which contains which enzyme. Okay, so that is option A is the pepsin. Yes, all of you know that pepsin is the proteolytic enzyme which is present in the stomach. Okay, which is present in the stomach. So means this is not our answer. So renin is the enzyme that is secreted by our kidneys, and in some renin is the enzyme that is secreted by the GI system also from the stomach. Okay, so this is not the answer. Okay, so ptyalin, another name of the ptyalin. Yes, very good students. Your answer is correct. That is who are choosing the option as the ptyalin. That is the correct answer. So another name of the ptyalin. Can anyone tell? Yes, that is the salivary amylase. Okay, it's a salivary amylase. Yesterday we have discussed this one in detail. Okay, so then what about lipase? Lipase in the saliva, lipase also there. If they have given the name that is a salivary lipase, that would be good. Okay, so lipase would be secreted by our yes pancreas. Pancreatic lipase will be there. Okay, pancreas. So the answer for this question would be option C. That is the ptyalin. The salivary gland which secretes the saliva, which also contains the enzyme that is the ptyalin. That is salivary amylase, which is responsible for the digestion of the carbohydrate, which is responsible for the digestion of the carbohydrate. So it will convert the compound carbohydrates to simple carbohydrates. Okay, so it converts this into starch. Okay, so it's very easy and very basic question. Okay, here is the next question. Yes, do read the question carefully, completely. Okay, then give your perfect answer. Students, very easy questions. You can like quickly revise this one. Okay, so BCG vaccine is given for the prevention of which of the following diseases. So the question is very simple. So BCG vaccine would be given to prevent of the which of these diseases. The given option is polio, TB, diphtheria, and tetanus. Students, BCG is the vaccine that is given to prevent the yes tuberculosis. Who all are the giving the option B as a correct answer? Your answer will be correct. Okay. So then my question is yes, what is the full form of the BCG? That is the Bacillus calmette-guerin. Okay, Bacillus calmette-guerin is the yes, full form of the BCG vaccine. Okay, so the next question on the BCG vaccine is so which diluent you will use to dilute the BCG vaccine. Students, all of you know that the BCG vaccine will be comes in the freeze dried form, means it is comes in the as the powder form. So in order to dilute this BCG vial, we have to use the yes, very good students, that is the normal saline. Okay, for measles we will use distilled water. For BCG dilution we will use normal saline. Okay, so very important. Okay, then what about the dose of the BCG? Okay, what is the dose of the BCG? Yes, if you are administering the BCG less than 1 month, so the dose would be 0.05 ml intradermal. Okay, and if you are administering the drug in the sense here is the BCG vaccine. Okay, so if you are administering the BCG vaccine after 1 month, means the dose would be yes, that is 0. Sorry, not 0. Okay, it's a 0.1 ml. Okay, just 0.1 ml. Okay, so this would be a dose of the our BCG vaccine. Okay, so then what is the most common side effect of the BCG vaccine? Okay, that is the lymphadenitis. Okay, lymphadenitis is the most common side effect of the our BCG vaccine. Okay, side effect, very simple. Okay, so these are the possible questions that may arise from the BCG vaccine. So there is lots of the question on the BCG vaccine, so simple and easy questions. Okay, and the repeatedly asked question I had told in front of you all. So we'll discuss the in detail related to BCG vaccine while discussing the immunization schedule. Okay, so then here is the what about polio vaccine. In polio vaccine we have the two types of the vaccine, that is a Salk and Sabin. Okay, so we will discuss that one while discussing the immunization chart. Otherwise our time will waste 2 times. Okay, so we'll discuss the rest of the vaccines while discussing the immunization chart. Okay, so I will take a class on the 120 important topics for our RRB. So in that one, the immunization also a very important 10-star topics. I will discuss the immunization topic in detail. Okay, so I am assured that out of 70 questions, 50 questions will be coming from that 120 topics only, that I am going to conduct in the form of the crash course for you all. Okay, so after completing this old question paper discussion classes. Okay, so be connected with the master nursing classes. If you are new to the video, don't forget to subscribe, otherwise you will miss the crash course. Okay, so very simple. So the next question for this session is very important. Okay, so which of the following is the largest digestive gland? Okay, the question is asking related to largest digestive gland in human. Okay, so the very simple question. Option A is the spleen, option B is the liver, then pancreas, then hepatopancreas. What is the answer, students? You all are very good students. Yes, that is the largest gland in our body is the liver, students. If the question asks what is the largest organ in the body, then also answer goes to be liver. Okay, then also the answer will goes to the liver. The question asked like this: what is the largest organ of the body? Means that is the skin, students. Skin is the largest organ of the body, and liver is the largest internal organ of the body. Okay, if the question asks largest digestive gland of the body, that is the liver. If the question is like this: what is largest endocrine gland of the body? That is our thyroid gland. Okay, thyroid gland is the largest endocrine gland of the body. Okay, very simple. If the question comes like this, what is the yes heterocrine gland? That is our pancreas, students, because pancreas is the organ so which acts as both endocrine, okay, and which acts as both exocrine, students. Okay, so it's 1% is endocrine function which secretes the hormones, and 99% is it is exocrine functions, okay, which secretes the enzymes. So it's doing both endocrine function and exocrine function. So it's doing both endocrine and exocrine function. That's what the pancreas is also called as a heterocrine gland. Okay, hope the concept is clear for you all. Okay, so very simple. I hope the answer is clear for this question. Okay, and four more possible questions I have told in this question. Focus while listening, okay, and make a notes of that. It will helpful for you all. Okay, so differentiation and study is the most effective strategy, students, that you make a champion by differentiating the question. Okay, so the question will like simply they are changing the question in exams. Okay, like largest endocrine gland in the human. So answer would not be a liver. Largest endocrine gland in the human is the, that is answer would be yes, thyroid gland. So that's what. So while listening, listen carefully and make a note of it. Okay, pause the video, make a note of it, and then start the video, because in each and every question I am telling four more possible questions. Okay, that will help you definitely in the exam, students. Okay, so yes, here is the next question. Simple question, students. So which of the following constituent of the food is cheap source of the energy? Okay, so from given following, which one is the cheap source of the energy? Yes, can anyone answer for this question? Awesome, awesome. Okay, so yes, the carbohydrates is the cheap source of the energy. Students, while studying the nutrients, we will study the macronutrients and micronutrients separately. So in the macronutrients, yes, in the macronutrients, we will study the carbohydrates, lipids, and proteins. In the micronutrients, we will study the vitamins, minerals, okay, and so on. Okay, so minerals and vitamins will comes under the micronutrients, carbohydrates, proteins, lipids. It will comes under the macronutrients. Okay, so what the question will ask this much only in the upcoming exams? No, students. They can ask the question somewhere else. Yes, the 1 gram of the carbohydrate give how much energy? Yes, 1 gram of the carbohydrate would give yes 4 kilocalorie. Okay, 4 kilocalorie. Then what about lipids? That is the fat. Yes, 1 gram of the lipid or 1 gram of the fat. Yes, it will give 9 kilocalorie. Okay, 9 kilocalorie. Then 1 gram of the protein, 1 gram of the protein, it will give yes again 4 kilocalorie. Okay, so it's very important. Vitamins will never ever give energy, students. Okay, sir, all these carbohydrate, protein, lipid, every all these macronutrients are giving the energy, sir. Then why you are considering carbohydrate as answer? Students, among all these four, the cheap source of energy is the carbohydrate. Okay, why? Because first and foremost, and for all important vital organs functions, the energy would be supplied in the form of the carbohydrate. If the person is starving, if the person is not having the food since from the 4 to 5 days, the storage form of the carbohydrate from the protein and lipids will get damaged and it will come after completing the glycogen, students. So glycogen is the storage form of the carbohydrate. It will be stored in our liver. Okay, when we will not have the food, so the body required glucose. If we are not having the food, then the stored form of the carbohydrate, that is the glycogen, it will break and it will comes to our blood. When the stored form of the glycogen finish, then after that the glycogen or the calories or the glucose from the, yes, lipid and protein will come to the blood. So that's what I am telling, it's a cheap source because it's a comes as a first and foremost as a energy for us. Okay, so that's what carbohydrate is the answer for this one. Okay, what is the another type of the question they will ask? Yes, they can ask like, the person is having the 2 gram of the carbohydrate and 1 gram of the protein and 2 gram of the lipids in his diet. Total how much kilocalorie he had in the morning breakfast, he will ask. Okay, so you have to calculate like this. The person is having the 2 gram of the carbohydrates means 8 kilocalorie he had, because 1 gram giving the 4 kilocalorie. Then the person is having the, yes, 1 gram of the protein means 4 kilocalorie he had. 4 plus 8, 12 kilocalorie. Then he is having the 2 gram of the lipids, then 18 gram kilocalorie he had. Okay, so then you have all you add all the sum like 8 plus 4 plus 18, so the final kilocalorie will get, so that is the perfect answer. Okay, so this is one kind of the trending question which is coming in front of you all. Okay, do focus on that one and solve the question very much easily. Okay, hope the concept is clear for this one. Here is the next question in front of you. Let's read the question carefully. Which of the following is the most common cause of the myocardial infarction? Myocardial infarction का most common cause क्या है? That is, option A is the hypertension, option B is the diabetes mellitus, option C is the atherosclerosis, and option D is the hyperthyroidism. Students, what is the most common cause of the myocardial infarction? Yes, all of you have given the correct answer. That is the atherosclerosis is the most common cause of the myocardial infarction. So, what are the risk which are forms the atherosclerosis? This is considering our coronary artery. Coronary artery is the artery which supplies the oxygenated blood to our heart myocardial layer. Okay, so in heart we are having the 3 layers, that is outer is the, yes, pericardium, middle is the myocardium, and inner is the endocardium. Among those 3, so very contractile part and thickest part of the our heart layer is the myocardium, where the smooth muscles, that is the cardiac muscles, will be there. Okay, so for that particular part the blood supply will be carried out by the coronary arteries. Okay, so if there is any damage to the coronary artery, okay, so I think like this is the epithelial layer. If there is any damage to the epithelium, okay, because of the hypertension, because of the any other toxins, okay, so then after that here the bad cholesterol like low density lipoprotein will start accumulating. Okay, so then it will form the foamy streak. Then after that the fibrin mesh will come and it will finish like this, and here is the finally it will forms the one atherosclerosis. Okay, whenever there is dislodgement of this atherosclerosis, okay, it will get blocks our coronary artery. So complete blockage of the coronary artery which leads to the myocardial infarction. Okay, when the chest pain arises, students, when the atherosclerosis blocks the 70% of the coronary artery, when atherosclerosis blocks the 70% of the coronary artery, that time chest pain increases. Okay, so if it blocking completely 100%, so that may leads to the our myocardial infarction. Okay, hope the concept is very much clear for this question. Yes, the next question is like this. Yes, read the question carefully, completely, and give your best answer. Very simple question, students. Which enzyme is most specific for the myocardial infarction? Okay, कौन सा एंजाइम है वो मोस्ट स्पेसिफिकली कंसिडर करेंगे मायोकार्डियल इंफार्क्शन के लिए. सो वी हैव हियर इज द कार्डियक एंजाइम्स लाइक CKMB, then troponin I, then yes, lactate dehydrogenase, then aspartate amino transferase. Okay, so students, all these enzyme rises. Okay, CKMB will also rises in myocardial infarction. Troponin I also rises in myocardial infarction. Okay, lactate dehydrogenase also rises in the myocardial infarction, and AST also will rises in the myocardial infarction. Whenever there is damage to the any muscles, these all biomarkers will increases in our blood. But the troponin I is the only specific it increases only in the damage of the myocardial muscles. CKMB, it will increases in myocardial muscle damage also in the, and minor in the other muscle damage also. Okay, lactate dehydrogenase LDH, it increases in the liver damage also. AST also increases in the liver damage also. There is any muscular structure damage at that point of the time, all enzymes rises, but troponin I is the enzyme which is very specifically rises in the myocardial damage only. Okay, so troponin I will not rises in the skeletal muscle damage, other like GM muscle damage. Okay, at that point of the time it will not rises. The troponin I, it will rises only in the cardiac muscle damage. That's what it is considered as the most specific. Okay, it is considered as the most specific enzyme for the myocardial infarction diagnosis is the troponin I. Okay, hope the concept is clear for this question. Yes, here is the next question for you all. Yes, read the question carefully, completely, then give the your perfect answer for this question. Yes. So, which of the following is the characteristic feature of the bacterial vaginosis, students? The question which repeatedly strikes in your exams, the question which is repeatedly comes in your NORCET exams, that is the S. Bacterial vaginosis and Trichomonas vaginitis, and S. The Candida vaginitis. Okay, so repeatedly asked questions, so that will helps in your RRB also. Okay. The question is very simple. Which of the following is the characteristic feature of the bacterial vaginosis? Okay. Option A tells like this: thick curd like discharge. Students, the thick curd like white discharge. Okay, with itching, with intense itching, or you can say pruritus at the vaginal area. So it will seen in the yes our candidiasis, vaginal candidiasis. The patient is having the intense itching, white curd like discharge, that is thick in nature. It will be seen in the yes vaginal candidiasis. Okay, this will be not seen in the bacterial vaginosis. So option A eliminates here. Then option B, what it is telling? Foul smelling, yes. Thin, yes. Grayish white discharge. Students, the foul smelling, thin and grayish white discharge, it will be seen in our bacterial vaginosis. Okay, your answer is the option B. Then what about option C? Option C is telling that frothy, yes, frothy yellow green discharge. Okay, frothy and yellowish green discharge. Okay, this the discharge, it will be seen in the yes patient with the trichomonas vaginalis. Okay, trichomonas vaginitis, not vaginalis, that is the vaginitis. Okay, students, you do focus over the questions. In the question, I have written this one as the bacterial vaginosis. Okay, so this is the protozoal infection, students. Okay, so here vaginosis. Sorry, this is the bacterial infection. Here the vaginosis I have written. Okay, in the vaginosis, why I have written vaginosis means after infected with this bacterial vaginosis organism, so we will never be get inflammation and itching. So in the bacterial vaginosis, there is no itching. Okay, there is no pruritus. Only from the vagina, foul smelling, thin grayish white discharge it will come. That classically and clearly indicating that the patient may having the yes bacterial vaginosis. Okay, so we will discuss this topic again with the management. Okay, and causative organisms. Okay, what is the vaginal pH change? Each and everything we will discuss, because these questions definitely strikes in your upcoming NORCET exam, students. Okay, so hope the concept is clear for this one. Yes, frothy yellow green discharge it will be seen in the trichomonas vaginitis. Foul smelling thin grayish white discharge will be seen in the bacterial vaginosis. Okay, thick curd like discharge will be seen in the Candida albicans. Okay, so here is the next question in front of you all. Okay, take a deep breath, close your eyes, then read the question. Open your eyes and read the question, then give the perfect answer. Okay, yes, the question is very simple. The amount of the ORS, that is the oral rehydration solution, to be given for each loose stool in a children's is less than the 24 months. What is the question is asking, students? So there is a child with the diarrhea. Okay, so for that children, so how much amount of the ORS we will give after each loose stool? Okay, this is the according to the WHO ORS strategies of the doses. So here Yes, if the child is less than 24, so we have to give yes how much ml of the ORS? Can anyone answer for this question? Yes, that is 50 to 100 ml of the ORS for each loose stool we will give here. Okay, so students, this is the dose schedule for your upcoming exams. This will definitely come in your exams. So for prevention of the dehydration, okay, ORS will be given for a patient with vomiting and diarrhea. Okay, so students, one more question it will come. So you are given the ORS to the child. Okay, and child vomited it. Child vomited it. What is the best nursing intervention? What is the best nursing intervention? So that is wait for 10 minutes and resume ORS again. Means resume ORS here again means give ORS again after the 10 minutes. Okay, this is the nursing intervention if the child vomits the ORS after giving the ORS. Okay, so here is the dose for the prevention of the dehydration. Okay, that is children if the less than 2 years or 24 months. So the dose will be yes 50 to 100 ml after each loose stool. Students, after each loose stool we have to give the 50 to 100 ml of the ORS. Okay, then what is the next one? That is the child from the 2 years to 10 years. So from child is belongs to the 2 years to 10 years means the child is of the age related to 5, 6, 7 years, 8 years, so 9 years and 3 years. That age of child we have to give the yes 100 to 200 ml of the ORS for each loose stool. Okay, write it down. Very very important. This is according to the World Health Organization. Okay, WHO doses for prevention of the dehydration. Okay, that is recovering with the help of ORS. Okay, so if the child belongs to the age of the more than 10 years, the dose would be 200 to 400 ml. Okay, after each loose stool, okay, we can give maximum up to 2000 ml daily. Okay, so the my next question is very simple. Okay, so you are giving one pocket to the mother of the child and you are asking the mother to give the 50 to 100 ml of the yes ORH after each loose stool of your baby. Okay, so how much duration she can use this one and in how many liter of in how many ml of the water she can dilute that ORS pocket? Can anyone answer this one? Yes, students. She can dilute that ORS pocket. Okay, she can dilute that ORS pocket in 1 liter of the water. Okay, so we can say in the 1000 ml of the water she can dilute that ORS pocket and she should and must use for this one for the 24 hours if not contaminated. Okay, if contaminated, discard and yes prepare again new one. Okay, so yes and this one also a very important questions that will comes in your exams repeatedly. That is the yes content of the our ORS. You can take a screenshot of this one. Okay, it will help for you all. Okay, so that is the sodium chloride amount in the ORS will be 2.6. So how can we remember this one? In the sodium, students, in the sodium there is di is there. Di stands here as the 2. Okay, and in the chloride CHL is there. CHL here is the che means 6. Okay, 2.6 gram of the our sodium chloride will be there. Then what about KCl is yes, so deduct 1 from the 2, that is the 1, and deduct 1 from the 6, that is the 5, means 1.5 gram of the our yes KCl will be there. Then come to the trisodium citrate. Okay, trisodium citrate. Tri stands here as the students. Tri stands here as the 3. So we can write 3 as a 2.9. Yes, we can write. So 2.9 gram of the trisodium citrate is there. Then glucose in the form of the dextrose, that is the 13.5 gram. You have to remember, we have to dilute it in the 1 liter of the water. Okay, so this is the content of the ORS. Okay, this is the content of the ORS. Okay, then what is the concentration of the ORS? That is the sodium 75 milliosmol per liter and glucose also 75 milliosmol per liter. They will ask the question which two components having the same concentration or the same osmolality in the ORS bucket. That is, students, sodium and glucose, these two components having the same osmolality in the ORS bucket. Okay, so of the concept clear. Then 20 milliosmol per liter of the potassium will be there. Then chloride will be 60 milliosmol, 65 milliosmol per liter. Then yes, the citrate is the 10 milliosmol per liter. So total osmolality of the ORS is the 245. Okay, so total osmolality of our ORS will be 245 milliosmol per liter. Okay, hope the concept is clear. here the sodium is having the 75, then glucose is having the 75. The question came like this recently, which two components, yes, they have the same osmolality in the ORS pocket, that is sodium and glucose is having the same osmolality. Hope the concept is clear, and this remembering trick will be very much helpful for you all. So di here is the 2 to have written, and chloride CHL, that is a Che, I have written as the 6, 2.6 gram of the sodium. Then deduct 1 from the 2, that is the 1, okay, that is the, and deduct 1 from the 5, that is the 5, deduct 1 from the 6, that is the 5, that is the, yes, 1.5 gram is the our KCl, 2.6 gram is the our sodium chloride, and trisodium, tri stands here as the 3, okay, 3 we can write as the 2.9 gram, okay, then glucose is the 13.5 gram, then water will be 1 liter, okay. Hope the concept is clear, and content will be very helpful, and you can remember this one and give best shot in your exam to get the rank. Then after result you have to tell me, sir, your tricks worked in the exam, okay. So this is the osmolality. Again, if you want, you can take the screenshot of this one, okay. So here is the next question for you all. Yes, the effect of the aspirin do not includes. So the question is very simple. The question on the drug, that is the aspirin, okay. So effect of the aspirin do not includes, okay, do not includes. So option A, that is the reduce in the fever. Students, as all of you know that aspirin is the antipyretic, aspirin is the antiplatelet, and aspirin is the non-steroid anti-inflammatory drug, okay. So it's antipyretic, yes, it's antiplatelet, yes, it's a NSAID, yes. So aspirin is all these three. So aspirin is the antipyretic, yes, it's antipyretic, means it will reduce the fever. So then in question they have asked, it not includes, effect it not includes, but it will reduces the fever, it is included, okay. So then option B is the reduction of the prostaglandin synthesis. As I told students, it is NSAID. So what is the work of the NSAID? How NSAID works? Yes, can anyone tell how NSAID works, students? So whenever there is damage to our, yes, any cells of the body like epithelial cells, from this one phospholipid will be released, biphospholipid. From biphospholipid there is release of the arachidonic acid, okay, arachidonic acid. So from this arachidonic acid, yes, it will stimulate the COX pathway, okay. From the COX pathway, this COX pathway, it will stimulate the prostaglandin, prostacyclin, and thromboxane A2. Prostaglandin, prostacyclin, and thromboxane A2 will be released from the COX, okay. We are giving the, yes, NSAID means NSAID, non-steroid anti-inflammatory drugs, which blocks the, yes, COX pathway. It acts by blocking the COX pathway. NSAID acts by blocking the COX pathway, so it inhibits the release of the prostaglandin. Yes, is this clear? Yes, it's clear. So reduction of the prostaglandin synthesis in the inflamed tissue, yes, it is reducing the prostaglandin because it is a NSAID, okay. Hope the concept is clear. It's antipyretic. This also concept is clear, okay. Impaired auto regulation of the kidney function. Students, yes, it will help for the damaging the kidney functions also if it is overdose, okay. So it will auto regulation of the kidney functions, it will be impaired if the aspirin will be overloaded, okay. So option D is, it's reduces the bleeding tendency. No, students, as I told, the aspirin is the antiplatelet drug. As I told, the aspirin is the antiplatelet drug. It increases the risk of the bleeding, okay. It increases the risk of the bleeding, it increases the risk of bleeding, okay. So that's what, it will not reduces the risk of the bleeding. The question asked, the effect of the aspirin do not includes, the effect of the aspirin is not including the, yes, reduction of the bleeding tendency, it increases the, yes, bleeding tendency. The answer for this question would be, yes, option D, that is the correct answer, okay. Hope the concept is clear, and remember 4 more points on the aspirin. Aspirin will be never ever be given with the NSAID, because aspirin also an NSAID, okay. So this is the NORCET 5 mains question, okay. So aspirin will be never ever given with which of the following drug, that is the, it should not be given with the NSAID, okay. So then aspirin will be never be given with the anticoagulant, because aspirin is the antiplatelet, and anticoagulant drugs like heparin and warfarin, all both together may again leads to increases the bleeding tendency. So never ever give with the thrombolytics, never ever give with the anticoagulants, Okay, that is the very important. Okay, so then aspirin chemical name is the acetyl salicylic acid. Okay, in the acetyl salicylic acid, I told the chemical name of the aspirin is the acetyl salicylic acid. So as it is a acid, if the overdose of the aspirin will be there, so it may leads to the metabolic acidosis. Okay, so the overdose of the aspirin which leads to the metabolic acidosis because aspirin is the acidic drug. Okay, hope the concept is clear, and 5 more questions on the aspirin will be helpful for you all. Okay, so here's the next question for you all. Read the question carefully, completely, and give your best answer for this question. Okay, yes. Retina in the eye acts as, very simple questions, students. Examiner, he compared our eye structure to one camera, then he asked the question. Okay, that is retina in the eye acts as all of you know that, yes, here is our beautiful eye. Yes, this is the outer layer of the eye. We can say that one is the sclera. Then after sclera, we are having our beautiful choroid layer. That is the middle layer is the choroid layer. Okay, let me change the pen color. This is the choroid layer. Then outer layer is the sclera. Then inner layer is the, yes, that is the beautiful retina. Okay, so I will highlight the retina here. So this inner layer is the our beautiful retina. Okay, so in the posterior part of the eye. Okay, so here is our optic optic nerve, it will enter inside. So this part we can say that is the blind spot. Okay, what we can say this one as the blind spot. Okay, here is our macula. Okay, so this macula, the depression in the macula. Okay, this one is the yellow spot. Okay, this one is the yellow spot. Okay, so students, this one first one is the our beautiful, yes, what it is, can anyone tell? That is the cornea. Then after cornea, we are having the pupils. Okay, the gap between the our iris muscles, that is the pupil. Then after pupil, we are having the lens here. Okay, so the options like this here. Lens in retina they have compared to the lens in the camera. No, lens in the camera will be the compared to the lens of the eye only. Okay, so then shutter in the camera. So shutter in the camera will be compared to the eyelids. Students, here we are having the eyelids which shuts down and opens our eyes. So shutter in the camera, yes, it will be compared to the our eyelids. It will be compared to the eyelids. Lens in the camera, it will be compared to the lens in the eye. Okay, film in the camera. Students, remember that one. This inside layer is the our, yes, retina. So this retina we can say sensory neuronal layer of the our eye. So in this one only the film focuses, and this one only give perception of the images to our, yes, the posterior, that is the occipital lobe of our brain. Okay, so this one only creates the image. So because of that the retina in the eye is compared to the film in the camera. Okay, hope the concept is clear, and yes, the question is understandable and easy for you all. Okay, so hope the concept is clear for this one. I'm moving to the next question. Just it is in comparison between the our eyeball and camera. Okay, so shutter in the camera, that is our eyelid. Okay, lens in the camera, that is our lens, and film in the camera, that is our retina. Okay, hope the concept is clear. Yes, yes. Okay, here is the next question. Yes, the possible cause of the retention of urine includes all the following except. So they have given the list of options here. So among these options, you have to find out the possible cause of the retention of the urine except one. Okay. Yes. Can anyone tell? Urethral obstruction will leads to the retention of the urine. Then first of all, you have to tell me what is the retention of urine. Retention of urine, it is very simple. This is our ureterus. Then this is the bladder. Okay, so this is our beautiful bladder. Okay, so this is the urethra. This is the urethra. This is the bladder. This is the ureters. Okay, if there is any obstruction in the urethra, okay, that may be due to the prostate gland enlargement. Okay, that may be due to the strictures in the urethra. Strictures means, students, this is our normal patent urethra. So if urethra is having like this bend, means we say this one as the urinary strictures. Okay, we will put catheter inside. and with the help of the dilator we will dilate again the urethra. Okay, so this is the prostate and urinary strictures or any kind of the urinary urethral obstructions. Okay, so it keeps the urine inside the bladder only, it will not allow the urine to come out. So that is what we call the retention of the urine. Retention of the urine means urine will not come out of the bladder, urine will remaining in the bladder only, that is called as the retention of the urine. Whenever it will occurs, it will occurs in the post-op conditions. Okay, post-operative conditions, because of the spinal anesthesia or general anesthesia, complete relaxation of the bladder muscles. Okay, which it will not contract properly, so then the urine will remain inside, so that may leads to post-operative urinary retention. Okay, so after the surgery or trauma, yes, urine can retain inside. Trauma to the genital area, okay, again which leads to the obstruction in the urethra, that kind of the situation also urinary retention will occur. If there is any obstruction in the urethra, yes, that time also urinary retention will occur. Okay, so yes, if there is an obstruction in the urethra, that time also urinary retention occurs. Then drugs like albendazole, there is no any relation to the albendazole and urinary retention, students. If there is any decreased stimulation to the muscle bladder in case of the spinal cord injury. Okay, so if the injury is lower part of the spinal cord, it may damages to the nerve supply to the our bladder. That time there is no any stimulation to the bladder to get urinate. Okay, which may leads to the retention of the urine. Okay, so that is also very important. Because of the spinal cord injury, decreased stimulation to the bladder, it may leads to urinary retention. Urethral obstruction, that is also leads to the urinary retention. And surgery and trauma, which is also leads to the urinary retention. Okay, so drugs like albendazole, it will never be causing the urinary retention. Students, yesterday we have discussed related to albendazole. Okay, so albendazole is the antihelminthic drug which will be given. Okay, it will be given to destroy the helminths from our intestine. Okay, so as I told, the dose of the albendazole is very important. If the child is more than 2 years, you have to give the 400 mg albendazole. If the child is less than 2 years, you have to give the 200 mg of the albendazole. So I have told you the nursing intervention. You ask the child to chew. Child to chew and swallow the tablet, not to directly swallow the tablet. If the child is chewing and swallowing the tablet, so that would be very effectively. Okay, so this is given in the biannual programs. Okay, so I will discuss while discussing the community. Okay, so now just you have to remember the dose of the albendazole. Okay, so very very important, students. Hope the concept is clear for this question. And answer for this question, yes, drugs like albendazole, it will be never ever causes the urinary retention, so it will comes under the exception. Okay, hope the concept is clear for this question. Here is the next question. Yes, read the question carefully, completely, and give your best answer for this question. Yes, very simple question, students. In olden days, when refrigerators did not exist, एक जमाना था उस टाइम पे फ्रिज ही नहीं था घर पे. इट वॉज ए कस्टमरी टू बॉयल द मिल्क ट्वाइस और थ्राइस इन अ डे. ये कस्टम बन गया था कि हमारे घर में जो मिल्क है उसको 2 टाइम या 3 टाइम हम बॉइलिंग करते थे, इन ऑर्डर टू प्रिवेंट फ्रॉम बिकमिंग सोर. उसको सोर होने में और कर्ड होने में बचाने के लिए ये करते थे हम. सो द रीजन क्या है इसमें? सिंपल है. इसमें जो भी बैक्टीरिया है, दैट इज द लैक्टोबैसिलस. ओके, किलिंग लैक्टोबैसिलस दैट कन्वर्ट्स इनटू कर्ड टू मिल्क. ओके, ये लैक्टोबैसिलस को किल करने के लिए हम 3 या 4 बार मिल्क को बॉईल करते थे, ताकि इसके अंदर जो भी लैक्टोबैसिलस है वो मर गए. ओके, सो वो मर जाए, उसके बाद हम सेफली रख सके milk. Okay, so hope the concept is clear. So we want to dye the lactobacillus from the milk. So if the lactobacillus is dead in the milk, so it will not convert the milk into the curd. Or in order to prevent the soreness of the milk, we have to boil the milk. Very very simple and logic question, students. Okay, so here is the one more very important questions. Okay, so yes, give the best answer for this question. The question is very simple. Platelet count decreases in. So which of the following condition where our platelet count decreases? Yes, is it in malaria, is it in filaria, is it in dengue or typhoid? Yes, all of you have given the answer, that is the dengue. In 2018 RRB question paper, students, there are a lot of the questions will be there in the easiest to easiest form, that you all can solve the questions. So in that kind of the paper, who have done the non-nursing part. Out of the 30, so who have done the 10 also correct, so they got selected in that particular exams, because the nursing question would be very easy in that papers. Okay, so don't expect the same in the current papers also, because now the level of the competition is changed and the examiner mindset also changed, students. That's what we are discussing, all possible questions in each and every question. Okay, so the platelet count decreases in the dengue, students. So now they can ask, yes, what is the very important nursing assessment you have to do in the patient when admitted with the dengue? Students, as all of you know that dengue is causing the platelet count to decrease. Okay, so there is lot of chance to get bleed. Okay, lot of chance to get bleed internally. Okay, so internal bleeding, it will not visible to us, but how can we identify, sir? We have to identify the internal bleeding. If the internal bleeding will be there, so the blood pressure will decreases. Okay, so the blood pressure will be decreases, means the volume from the our blood vessel will get decreases, means we have to assess for the blood pressure repeatedly. Okay, so then what else? We have to assess the heart rate. Why? Because the earliest sign of hypovolemia is our tachycardia. Okay, increase in the heart rate or the tachycardia is the earliest sign of the hypovolemia. So if you are focusing on the heart rate and if you are focusing on the BP, if suddenly heart rate increases, means there is highest risk of the hypovolemia is there. So that's what we have to monitor, the heart rate and BP. So there is decrease in the BP and increase in the heart rate, that indicating the bleeding is there inside the body. Okay, this is a very important nursing assessment, focusedly we have to do in the patient with the dengue. So then what is the very important nursing interventions? That's the continuing the IV fluids and encouraging the oral fluids. Okay, encouraging the oral fluids and continuing the IV fluids. As I told, there is highest chance of, yes, internal bleeding, then reducing the BP, then increasing the heart rate will be there. So because of the reduced BP, so there is highest chance of the shock. So we call that one is the dengue shock syndrome. Okay, in order to prevent that, so we have to keep the intravascular volume always full. So that's what IV fluid should be continued continuously. Then oral fluid will be encouraged in order to prevent the dengue shock syndrome. Hope the concept is clear here. Okay, so yes, so this is the very important last question of this particular day. So hope the concept is clear today. So we will discuss again the more important question in the tomorrow's session. Okay, again I will come up with very important questions and the nursing interventions. Okay, and the management in which disease, what to think, what to process, how to choose the option, and how to deal with the questions. That will be very helpful for your RRB exams, students. From my side, I am giving the best of to best content. Okay, so that is what I want to give to my students in the form of the content. Okay, so if the content is helpful for you all, and if the content is really boosting your scores in your mock test and your other test, or else your test series, so if it is found helpful, so please do like to the channel. Okay, please do subscribe to the channel and share the content with our friends who all are preparing for the RRB exam. Students, it is very important to share the knowledge. Okay, in order to gain the knowledge. Okay, if you are sharing the knowledge, means you have to focus. If you are sharing the knowledge, means you have to share, like you are giving some gift to your friends also. Okay, so that is what I want. If my struggle is helpful for you all, don't forget to subscribe and don't forget to hit the like button. Okay, so be connected. We will discuss the more very important questions in the next session. Again, I will connecting with you all with the part 3 video of the RRB own question paper discussion. Okay, so stay tuned, stay connected. तब तक के लिए जय हिंद, जय भारत.